A step over obstacle.
So I'm going to have you begin at your normal walking pace, and once you reach the shoebox, step over it, not around it, okay? And begin. The patient scores a 3 if she is able to step over 2 stacked boxes without changing gait speed and no evidence of imbalance. A 2 if the patient is able to step over 1 box without changing gait speed, no evidence of imbalance. A 1 if the patient is able to step over 1 box but must slow down and adjust steps to clear box safely. And a 0 if the patient cannot perform without assistance.
Gait with narrow base of support.
So I'm going to have you, with your arms across your chest, walk heel to toe as far as you can to the next line. The patient scores a 3 if she is able to ambulate for 10 steps heel to toe with no staggering. A 2 if the patient is able to ambulate 7 to 9 steps. A 1 if the patient is able to ambulate 4 to 7 steps. And a 0 if the patient ambulates less than 4 steps heel to toe or cannot perform without assistance.
Gait with eyes closed.
So I'm going to have you walk from this mark to the next with your eyes closed and begin. Alright, stop. Okay. The patient scores a 3 if she is able to walk 20 feet with no assistive device, good speed, no evidence of imbalance, normal gait pattern, and deviates no more than 6 inches outside of a 12-inch walkway. A 2 if the patient is able to walk 20 feet, uses assistive device, slower speed, mild gait deviations, deviates 6 to 10 inches outside of walkway, and ambulates in less than 9 seconds but more than 7 seconds. A 1 if the patient walks 20 feet, slow speed, abnormal gait pattern, evidence for imbalance, and deviates 10 to 15 inches outside of walkway, and it requires more than 9 seconds to ambulate 20 feet. And a 0 if the patient cannot walk 20 feet without assistance, severe gait deviations or imbalance, deviates greater than 15 inches outside of walkway.
GA ambulating backwards.
Okay. So what I'm going to have you do is turn around, and with your eyes open, I'm going to have you walk backwards, okay? And begin. Alright, stop. Okay. The patient scores a 3 if she is able to walk 20 feet, use no assistive device, good speed, and no evidence of imbalance, and deviates no more than 6 inches out of walkway. A 2 if the patient walks 20 feet, uses assistive device, slower speed, mild gait deviations, and deviates 6 to 10 inches outside of 12-inch walkway. A 1 if the patient walks 20 feet, slow speed, abnormal gait pattern, evidence for imbalance, deviates 10 to 15 inches outside of a walkway. And 0 if the patient cannot walk 20 feet without assistance, severe gait deviations or imbalance, and deviates greater than 15 inches outside of 12-inch walkway or will not attempt task.
GA steps.